So this is a case of a 62-year-old gentleman who presented to your clinic with left axillary lymphadenopathy. His past medical history is noted here with a history of a DVT and somewhat unusually, a history of CMV infection. It's not clear what that is, but that's a pretty unusual situation. Laboratory studies at baseline were normal. CBC and LDH were normal. Were not given the beta-2 microglobulin information. He underwent a left axillary lymph node biopsy, which showed a CD10 positive follicular lymphoma, grade 2, and further staging studies, including a PET-CT scan, showed multifocal disease, multiple sites of adenopathy, and the bone marrow biopsy showed about 30% involvement. So as part of the workup, you calculate the FLIPI score, and the FLIPI score for this gentleman apparently is a 2, which would mean that we would expect about a 50% 10-year overall survival, at least based on the historical original FLIPI data. And he is treated with bendamustine rituximab and receives 6 cycles and achieves an unconfirmed complete remission. The prognosis of this patient can be somewhat predicted by the FLIPI score. With a FLIPI score of 2, we would expect about 50% 10-year survival, at least based on the historical FLIPI data. We expect it's probably better than that, because that was based prior to many of the modern regimens pre-rituximab era. FLIPI score of 3 would be about a 30-35% 10-year survival. The first question we have when we have a patient with an indolent lymphoma is whether or not they need treatment. That's the first question that we ask ourselves and discuss with the patient. And we usually use these things called either NCCN or GELF criteria. It has to do with, does the patient have symptoms? Are their cytopenias related? Does the patient have high tumor burden? Officially by GELF has to be 3 sites over 3 centimeters or 1 over 7 centimeters. And it's not completely clear from this case history, but presumably one might be able to attribute this clot to the lymphoma. And it sounds like this patient may have had symptoms that justified treatment. So this was the reason for likely choosing bendamustine rituximab. There are no major differences between the NCCN and GELF guidelines. One thing that we do keep in mind is, particularly in the NCCN guidelines, is pointed out that patients who are eligible for a clinical trial should be considered for a clinical trial.